topic today we are going to discuss is about developmental anomalies. Okay, developmental anomalies is a very favorite university long essay based question. So here in this class we will be discussing about developmental anomalies, the previously asked questions regarding developmental anomalies and how you should answer such long essay questions, and few about your INICT or your NEET competitive exam level questions. Okay, so coming to your developmental anomalies, so you should always face a long essay type questions with a table of contents. Okay, giving a table of contents in the beginning will help you to score good marks. Okay, so here we'll be discussing about basics of developmental anomalies, the introduction, the etiology, what are the reasons for this developmental anomalies to happen, and how we can classify such anomalies. Coming to introduction, so what are craniofacial anomalies? Cranio and facial anomalies. Cranio means your cranium, your head, and facial means your face. Okay, so anomalies regarding your cranium and the face. So it is a group of abnormalities of cranium, that is your head, as well as your facial bones. Okay, and that occurs from the time of birth. You can see that in a newborn child. Okay, so it is occurring within the womb. Okay, when the child is born, you can see such abnormalities of head as well as face. So such abnormalities are called craniofacial abnormalities. Now come to the etiology. What are the reasons why this craniofacial abnormalities really happen? One thing, it can be due to their gene mutation, genetic mutation, some mutations happening in the DNA, happening in the gene, which can cause such kind of abnormalities to the child. Other thing is not about genetics, it's some of the environmental factors. Environmental factors means that it's not from the gene, it is coming from outside or coming from the environment after the birth or during the birth, how the environmental factors can cause such kind of abnormalities. Other thing is your nutritional deficiency. When the mother or the child is having nutritional deficiencies, okay, such deficiencies, example your vitamin deficiency, vitamin B12 deficiency or folic acid deficiency. Example is your folic acid deficiency. So what happens when the folic acid is deficient? That can lead to neural tube defects. Okay, neural tube defect. So such deficiencies also can result in developmental anomalies. Now come to the classification. Okay, developmental anomalies can happen anywhere in your face as well as your head. So it can occur in the jaw. Okay, on your jaw, on the face, facial bones, in the lips and the palate, or the oral mucosa, or the tongue, the salivary gland, or even the tooth. Okay, so anywhere it can happen. So what are the different developmental anomalies occurring in these structures that we will see in detail? Okay, so what are the developmental anomalies of your jaw? Jaw means your maxillary bone, your mandibular bone that make up the upper jaw and the lower jaw. So agnathia means you have an absent jaw. The jaw is completely absent in a patient. Okay, either the mandible or the maxilla is completely absent. Micrognathia. Gnathia means jaw. Okay, micro is small. So we have a small jaw, right? Micrognathia. Either the mandible or the maxilla is small. Okay, small. Macrognathia. Macro means large, and gnathia is jaw. So it is large jaw. Okay, so these are the three developmental anomalies of your jaw. It can be agnathia, micrognathia, and macrognathia. Now come to the next. What are the developmental anomalies of the face? Okay, coming to the face, if you take the face, I'm going to draw a face. Here you have a face, you have your nose. Okay, some kind of abnormality occurring on the face. So one thing is hemihypertrophy. Hypertrophy means increase in size. And it is hemi means one side of the face is having increased size. Okay, so hemihypertrophy is one side of face is increasing in size. So that is hemihypertrophy. And what about hemiatrophy? Atrophy means reduction in size. Okay, reduction in size. So hemiatrophy, that is one side of the face is reduced in size or atrophied. Okay, one side of the face is reducing in size, that is hemiatrophy. So what happens when one side of the face is hypertrophied, or what happens when one side of the face is atrophied? When there is hypertrophy, the structures on one side of the face, your tooth, your salivary glands, your tongue, okay, all will be increasing in size when there is hemihypertrophy. And when about hemiatrophy, what happens? The salivary glands, the soft tissues, your tongue on one side of the face will be reducing in size. So that is called hemiatrophy. Okay. Now come to the next anomaly. That's very famous anomaly. That is your anomalies of the lip and palate. Okay, that is very repeatedly asked question. Okay, what are the developmental anomalies of the lip and palate? Okay, so first one is your paramedian lipid. Paramedian means you have the lip here. Okay, you have your upper lip and the lower lip. Okay, so this is the upper lip and this is the lower lip. So there are certain anomalies when you see depressions. Okay, depressions. Okay, depressions or pit in the lip. Okay, depressions or pit in the median. This is the midline, and you can see depressions in the midline. So that kind of defects are called paramedian lipids. Okay, what about commissure lipids? Where the commissure lies? Commissure means at the corners. Okay, here it is commissure. Okay, so those are commissures. So depressions or pits present in the corners of the mouth, they are called commissural lipids. Okay, next is the very famous your cleft lip and cleft palate. Okay, that's a very important. We will be discussing this cleft lip and palate in a long video. And other are cheilitis glandularis and cheilitis granulomatous. Itis. What is mean by itis? Itis means inflammation. Inflammation. Itis denotes inflammation. So some kind of inflammation of your lip. Okay, cheilitis means inflammation of your lips. Either it can be glandularis or granulomatous. So these are the developmental anomalies of the lip and palate. Coming to the next, that is the anomaly of your oral mucosa, the cheek, your lip, the oral mucosa, the mucosal membrane covering your oral cavity. Okay, what are the anomalies there? First thing, the very famous one, what you are seeing is the Fordyce's granules. Okay, Fordyce's granules. Fordyce's granules are nothing but what? Ectopic sebaceous glands. Sebaceous glands. So, what are the sebaceous glands which make sebum? Where it is normally present on your skin, where there is hair follicles. Okay, sebaceous glands are present where you have your skin and the hair follicles that makes your skin waxy. So it is not present in your oral cavity. Oral mucosal membrane doesn't have any sebaceous gland because there is no hair follicle there, no sebaceous gland there. Okay, so some people, okay, some people, what happens is the sebaceous gland which is present in the skin, that will be present within the oral cavity as yellow color, yellow spots. Okay, yellow spots. So that is present in certain people's oral cavity. So it is not supposed to be present there. It is something ectopic. Ectopic means it is new to the area or foreign to that area. Okay, so ectopic presence of such sebaceous glands in the oral cavity, and that is called Fordyce's granules. Okay, so that is a normal phenomenon. Okay, normally you can see that doesn't make any harm. Other one is that focal epithelial hyperplasia. Epithelial hyperplasia. Hyperplasia means increased in number. Hypertrophy is increase in size. Hyperplasia is increase in number. And focal epithelial hyperplasia, from the name itself. In pathology, you read the name very carefully so that you can get the answer. Focal means at certain focus. Epithelial, the epithelium grows more in number. So that is called focal epithelial hyperplasia. So those are few anomalies of the oral mucosa. Now comes next. So the next anomaly here is the developmental anomaly of your tongue.